And robots are in use in many industries, and they are known or used where you need precision, productivity, and efficacy. First robo was used for neurosurgical biopsy in 1988, and same robo with some modification was used for TURP, prostate surgery, in 1991. Subsequently, many robos came in picture for various general surgical work, and subsequently in orthopedic for TJA. Imperial College London developed this Acrobot in early 1990s, and Robotic was developed by Think Surgical California. So imageless systems we have, Lee Smith and nephew Corey Nevio, and some of them are image-based, Cubis from Curexo, Mako, and Rosa from Zimmer. But Cubis is only fully automated system in use currently for total knee replacement, and they also have now software for partial knee replacement. So Cubis system needs a pre-op CT scan, and where pre-op planning is done, it takes around 10 minutes only, and it is not done by technician. I mean, they do those auto segmentation, and then you go through the plan. You go through a couple of slides and plan it, and as I said, it just takes 8 to 10 minutes. And the distinct advantages of this CT planning, as it is applicable in Mako as well, that you come to know regarding various fine landmarks, and you can identify these landmarks: center of the femoral head, center of the knee, ankle, and so precisely. Because imageless system, you never know what is the size of the head, you don't know the neck shaft angle, you don't know the anteversion, how you locate the femoral head center, that is a big question. I'm not here to debate. All systems, they have their positives and negatives, and whatever system is good for your working in your hand, some technology is required here, okay, for arthroplasty. That should be the take-home message. I mean, it's your call which system you opt for. And once all these landmarks are identified at the end of the planning, you get this picture where you know how much distal medial you are going to resect, distal lateral you are going to resect, posteromedial, posterolateral. This resection is guided by size of the implant, because that is going to define your posterior condylar offset. And similarly, you know the posterior slope and resection on the medial and the lateral side of the tibia. And once you have this information, you save it on your laptop, that is fed to the robo. And this robo preparation or registration goes on simultaneously when anesthesia work is going on. And this calibration is done for each and every case separately. Once the basic calibration or registration preparation is done, then robo is ready. These points are identified on bone, which takes around 10 minutes, around 8 to 10 minutes for registration. And once all these points are identified and you are happy with the gap check, then you can proceed with the resection. This is how it appears on the screen. And this is distal femoral cut. This is completely automated robotic system, and this is highly precise. So here there are two way, one is CT planning and other is intra-op. So it is completely controlled by surgeon. And once you are okay with gap checks, everything, then only you proceed with the resection. And the resection takes around 10 to 12 minutes. And consistently we are able to complete all the resection before we proceed with the final implantation in around 30 minutes time. So my staff is also happy, sir, isme thoda sa kam, get less fatigue and less tired, because they just stand and watch the system work, and it is absolutely comfortable for everyone, including the surgeon, and that's the end result you get. So couple of patients I'd like to share, pre-op and post-op, and another patient with severe deformities also. So in afternoon talk, I'm going to share a couple of cases more. So friends, our experience, there is definitely learning curve around 8 to 10 cases. It is precise system. Most of the cases we ended with 9 or 11 poly. That's what any arthroplasty surgeon would desire. Less drain, pain, and shorter hospital stay. So do you still doubt active robotics existence? Thank you very much.